The Circle of Care provides a process that delivers the greatest success through diligent focus on important skills.
I think there are very specific components that are necessary for an effective team. One of them, I think, is the fact that I think the team needs to be very structured. I think that the team needs to have clear and common goals, and those goals need to be communicated very clearly. In the NICU, we have shared governance as well as lots of committee participation. So we have several teams. And the structure comes in, the supervisor is a liaison in all of those teams. We try to make sure that the teams are multidimensional, not necessarily multidisciplinary, but across all shifts, so that there is really a lot of staff involvement and participation in those teams. One example we have is we have a developmental care committee who has been very instrumental in improving the processes that we have in the NICU for developmental care. It is a staff-led, staff-driven committee, but very structured because there is a supervising liaison who's also a management connection in that committee as well. So I think that structure, clear common goals, and communication are very important in having an effective team.
Sometimes we have to deliver bad news to a patient, and by focusing on the people pillar, we sometimes and often bring the nurse navigator into the room along with the patient's family, and that information is delivered in a more sensitive way to the patient. So by focusing on that people pillar, we've also helped to deliver great customer care to the patient in a sensitive manner.
The Baylor Diagnostic Imaging Center at North Dallas staff, we have a common goal and a common purpose for our patients in trying to create an ideal patient experience. And the way we do that is we're working together as a team. We're communicating well with one another. From the first time the patient walks into our center, that they're greeted with a smile and with eye contact. And the front office offers to help the patient, go through their paperwork if needed. The handoff to the medical assistant, making sure that the front office is really thoroughly communicating with the medical assistant before that handoff takes place. Then the medical assistant takes the patient from the front office area into the clinical area and gathering additional information. Then another crucial handoff goes back to the technologist. Then the technologist takes that patient right to the exam room, where they're obviously focusing more on the exam itself and answering questions and concerns, making them comfortable. And so we're creating a quality for the patient all the way from the front office, from the medical assistant to the technologist. And that will create, the best possible outcome for the patient. There again, with those positive impacted handoffs, there's a lot of communication, and it's going to be the best experience for the patient, and obviously will increase our likelihood to recommend.